Hi, everybody, and welcome to our BrightTALK series in COVID-19 and healthcare leadership. Today, I am joined with Matt Houston from GHX to talk about how to manage healthcare supply chain and finance in the age of COVID-19, bringing together two worlds that need to partner very closely together. Matt's going to talk about some of those concepts here today, but I'll go ahead and let you introduce yourself, Matt.
Great. Hi, Tracy, and hi, everyone. Thanks for having me on this event today. I've been at GHX for over 11 years and been able to really be contributing to a number of different healthcare challenges over that time. And we're in a really dynamic environment in healthcare and in the US. So there has been no shortage of interesting things to work on in that amount of time. And just with the level of engagement that we have with our customers and partners, it's a really interesting and dynamic environment. And I've had the privilege of being able to work across that environment. So providers, suppliers, both large and small, distributors, GPOs, group purchasing coalitions, and then also have had some opportunity to work with standards bodies, and including some think tanks and folks that think a lot about where we're headed and where we need to go and the kinds of things we need to do to support that to deliver better patient care. And then also even opportunities to work with entities like the FDA and folks like that are in some ways setting kind of a combination of setting direction, but also responding to regulation. And how do we best do that? So prior to that, I kind of consider myself a lifelong student. So I think, having a healthy sense of curiosity and always trying to learn more about what folks are going through, it really lends itself to healthcare and also to the approach that GHX takes, which is really around how do we help all participants in the delivery of healthcare to be able to reduce costs while still increasing the overall quality of care and quality of life for patients. So I think you put those things together, and I was fortunate to land in a good spot and be here at GHX for a while, and help our constituents really continue to excel within a challenging environment.
Yeah, that's great. It's a good thing that you are a lifelong learner, because anyone who has ever worked in this field knows that you learn something new every day, especially with the wide array of people that you get to interact with. That's part of the job that I love, is that every day that there really is something new to learn, and I get to say, oh, I didn't know that, or let me find out how that works, because it is a very deep and interconnected web of people that you've already described. So that's wonderful that you're able to do that. Can you tell us a little bit more about, for those who don't know, although I'm sure most do, but just a little bit more about what GHX does across the healthcare continuum?
Sure. So GHX has been around for a little over 20 years, and we're the world's leading digital trading and data network that securely connects all the different constituents that buy, sell, and use products needed in the delivery of patient care. We work with more than 80% of the care deliverers in the US, as well as the majority of suppliers. And we also have deep relationships with contracting entities like GPOs, et cetera, that have resulted in one of our key areas is that in that period of time, we've helped take tens of billions of dollars of cost out of the delivery of care in partnership with all of our customers and constituents. And just in the last 12 months or so, that's nearing $2 billion, 1.6 to $2 billion in costs that we've partnered with our customers to take out of the delivery of healthcare. So we take a lot of pride in that and are very focused on equitable value. So very often with supply chain and with finance and other places like that we really focus on, a lot of solutions to problems end up being more equitable to one or other or trading partners. And we really focus on how do we make sure that the cross section of trading partners or relationships that are happening to deliver care are getting equitable benefit from the solutions that we deliver. So I think that's been a really important factor in both. We have a unique approach to how we engage customers, and we also have a unique approach in how we take cost out of the system.
That's great. You definitely sit in a nice part of the world to help us solve some of those issues, or at least be able to help us address them, if not solve them. And, this last year, and I can now say last year, although we're still living in our, COVID times and dealing with a lot of the same stressors and supply chain shortages and issues around staffing and when the vaccine will come out. So we have a long road ahead of us. But with 2020 sort of in the rear view, I'm curious, given your unique position within the market and your touch points across all of the players that you described, what are some of the observations that you made, or that GHX as an organization made, in just navigating through COVID-19 in the early days, and where do you sit now?
Sure. Well, I think it's hard to look at that, the series of events, and not just have, probably for all of us, overwhelming amounts of information, and unfortunately a lot of it really is hard, challenging information. The amount of loss, and again, I'm going to focus here really on the business side for all of us, and how we use that to enable patient care. And I definitely don't want that to sound like I'm glossing over the real human cost, right? So I'm just going to say that up front, because that should be the most important focus for all of us, and the thing that impacts our daily lives. But that said, I think there's, the impact to the business of delivering healthcare and delivering quality to patients has been, unprecedentedly impacted, right? So, billions of dollars, millions a day per hospital, whether you're large or small, in losses. I think, some of the data I've seen recently is, somewhere in the order of $300 to $400 billion of loss over the course of 2020. And like you said, unfortunately, that's, those challenges are still continuing into this year. So, thinking broadly about how we can continue to address these challenges. And frankly, I think part of what you and I will talk about too is, there's actually some precedent for these things too that carry over once we're past these initial really, really hard challenges of a pandemic. There are a lot of elements of how we respond to this, and what we take away from it, that actually parlay directly into better ways to manage patient care in the face of the things we were already dealing with, right? So the shift to value-based care, and outcome-based orientation of our care delivery units. Those are things that are going to persist, and actually some of the things that we'll learn from our COVID response can help us be better when we emerge back into that kind of a situation, right? So there's a couple of things that I think have been kind of interesting to think about. One is that COVID has definitely exposed where what used to be nice to haves or aspirational things have become must-haves, right? And some of the things we'll talk about there in the area of automation, visibility, the way we manage data, and also the way we manage our relationships, right? So with our vendors, with our GPOs or purchasing coalitions or other entities that we're partnered with. So it's this nice to have aspirational becomes must have is one sort of theme. And another is that kind of ironically, a lot of what I would call traditional supply chain best practices or traditional best practices turned into risk. Or they created risk, or they hurt our agility. And so some of the things to think about there are, best practices around vendor consolidation. When you need to urgently find alternative vendors for things like PPE, you were left back standing. You were basically back on your heels at best. Frankly, some people were frankly, down on the ground, trying to figure out how to source things. I think there's no question that for all of the efficiency gains and benefits that were driven by just-in-time types of practices for inventory, boy, were they a huge risk during this COVID time, right? And for some areas, they continue to be, right? And then even things like policies and practices that we follow across the spectrum of supply chain, sourcing, order management, and then ultimately, and financing across those things. A lot of times the policies also created risk and weakness in our ability to respond to COVID. So it's been kind of interesting. I mean, there's a lot of ways you could look at this, and it's been a very dramatic event and traumatic event, for all of us, both in healthcare and outside. But I think, it was kind of interesting reflecting on this and thinking about, wow, things that were solid bedrock practices actually turned into problems for us and created some weakness.
Yeah, certainly. And I think there's a lot of conversation still around how those practices do evolve, or what is still really core to what needs to happen across the healthcare system. In addition to the problems, you also talked about the opportunities that were illuminated in terms of how people work together and just the shift in how people had to think. For at least the last, but I'd like to think that when we shifted from thinking of supply chain as just materials management, boxes in and boxes out, to being a strategic partner within the healthcare unit, obviously that then tied the financial arm and supply chain a lot deeper. So are there things that you noticed during COVID that helped even progress that even further, or any other tips that you can give, and how finance and supply chain can be true partners as we recover and move into sort of the next generation post-COVID?
Sure. I think some foundational things kind of building out of those observations, right, are it greatly exposed where folks didn't have automation. Then it greatly exposed the risk and that was brought into play because of not having automation and those practices in place. And that's both systems and processes, right? So that's a bedrock. So we'll talk about some specific things in a minute around that alignment, but you sort of have to set the foundation, right? So a lot of folks, found out in some cases the hard way that automation across those systems, right? So not just the supply chain systems, but also the finance systems. And then thinking about, you made a great point about how those come together, and we'll talk more about, a more holistic approach. And like I said earlier, I think that more holistic approach lends itself very well to the underlying challenges of delivering healthcare post-COVID, right? So outside of a pandemic or a catastrophic event, just the day-to-day management of delivering value, right? Value-based outcomes, all of these practices play into that, right? And coming out of it on the right side. So automation's one, visibility is another. So, there are some ways that having that automation in place on a platform that lets you see end to end gives you the ability to have visibility across those things. And then in the spirit of a holistic practice, and I'm sure we'll dig on a few of these topics too, it's this, if you think of like concentric circles, what this is really pushing us toward is there's sort of always been the concentric circle of the function and what you do. So let's just call it supply chain. I know that's bigger than a few functions, right? But for the sake of argument, supply chain and finance. But those concentric circles need to get bigger. And in fact, I would argue that the COVID situation has shown us why they need to get bigger, right? So if that's the middle, if that's the starting point, then immediately you sort of have to expand out and make that it's across those functions and those capabilities within your environment, whether you're a freestanding not-for-profit or whether you're a large for-profit IDN or wherever you sit in that spectrum. Being able to have that visibility and automation across all those processes, that's sort of the baseline. But then think about what COVID showed us was, again, across that spectrum of size, your risk was greatly impacted by how many relationships you had outside of yourself. So whether that's with your GPO for contracting flexibility, and if you didn't have a GPO, maybe you had a purchasing coalition or something. When we talk about things like inventory management, folks had to respond to COVID. In some cases, very small, not even regionals, had to create sort of a, de facto regional. And they relied on one another to basically pool their resources and pool their ability to do inventory and things like that, right? So you have to have visibility to pull those things off, right? And then there's those things kind of build this ability to have agility and flexibility. So with that as the foundational point, to answer your question about, how does finance and supply chain stay in lockstep? That's the foundation. So there's lots of things people can do to try to enhance those things, and platforms like GHX, right? Whether it's on the payment side or whether it's the supply chain side or contracting, that helps. GPOs and purchasing coalitions often have contracting tools, right? That can help provide a platform-based approach to those things. And there's other examples. But I think alignment, so getting after supply chain and finance, alignment is one thing that's super important. And what I would argue is different today is historically that's process and policy driven, right? What's different and what needs to happen is it has to become outcome driven, right? So what outcome are all those parties driving together, and then deliver from that outcome these joint policies and deliverables, right? And move away from functional priority and functional policy. And we'll sort of hit on why that matters. Visibility, we already talked about that. All these visibility has to be shared across not only those functions, but the tertiary functions they work with. So again, that could be a really critical vendor. It could be secondary or third-party vendors, right, that are required to flex for things like this. It can also dive deep into the contracting process, and we'll talk about that in a minute too. And then, you have to have a process and a platform to pull all those things together. So again, there's this common theme of, sometimes, especially if you feel like you're an isolated IDN or maybe a small one, right, a 2 or 3 hospital critical access or something like that. Getting visibility and access to where you could flex or be more agile is really hard, right? And it can be overwhelming. So in many cases, platforms help you do that. They help you act and see bigger than you are. And that helps you in turn become more efficient at how you deliver care to patients. So alignment, visibility, and then process and platform are the things that I think, finance and supply chain really can continue to double down on. How do they work together, and how do they create an outcome together?
And do you think that is that the same across when you're talking about a large, you mentioned IDNs, to maybe how do rural critical access and smaller hospitals find a way to modify all of those tips to do this, to have the same measures of success, do you think? What does that look like?
Yeah, I mean, I think the roadmap, if you will, is really similar. But I think the execution is different by necessity, right? So on the one hand, you want to make sure that you are, as much as you can, leveraging platforms, whether those are and in fact sometimes smaller ones, as they're able to do things like migrate to cloud-based ERP systems. And I know that comes with financial challenge as well for a lot of smaller systems. So it's not a de facto, but sometimes those kinds of moves can really bring even more dramatic benefit to a very small system or a freestanding facility than it does to really large, organizations. So one is that, are you looking at platforms or things that look and act like platforms that you can participate in? Sometimes that means that you might have to look at doing that together, right? So you create a coalition of some kind, and we've seen a lot of that, right? So we've seen a lot of either standalone or very small systems working with either existing regional purchasing coalitions that they might not have worked with much before. And frankly, in some cases with COVID, we've seen folks create them, right, out of necessity. In fairness, sometimes that necessity is born out of purely, I have to find another source to keep me confident that I'm not exposing risk on PPE for my staff, right? So it could be very, very practically driven, but I think it has the seeds of good practices to continue beyond the current crisis, right? So platform, trying to automate as much as possible. Again, sometimes those things feel like nice to haves, but I think COVID's proven that they're must haves, right? To be able to manage better in the future. And then being able to collaborate, what are the systems and tools that can help you collaborate? Think about those relationships differently, whether those are regional, GPO. Frankly, a lot of IDNs have also been doing and supporting smaller standalone hospitals in their need, and also in a way of thinking differently about how to secure not just inventory and supply chain activity, but even in some cases financing, and as we know, a totally different topic, but even insurance and co-insurance, right? So very often the large IDNs or super regional IDNs can be sources for and almost turn into kind of a mini regional coalition. And many of them are wanting to do that. And interestingly enough, and maybe not surprising, some of that will flow out past COVID, right? Which is that in a lot of cases, that's also a way to better deliver health to a community, right? specialties that it doesn't make any sense, as an example, to have a particular specialty in a very, very small, maybe a 50-bed standalone hospital. So you want to create a coalition to provide that service to your community, but do it through a larger that can handle it. And likewise, if you go to a larger to get that surgery, you probably want to have some way of delivering their post-surgery care where they live, right?
Yeah.
And so we've all seen that trend well ahead of what we're dealing with now. But these same principles should and could apply to how we respond to something like COVID.
That's very helpful, and as an interesting side note, and then I want to shift away from commodities for a moment, but our organization, the Center for Health Affairs, was actually started during the Spanish flu pandemic. So you are correct that, well, the association started before that, but then the Regional Purchasing Coalition really was born out of the necessity of regional hospitals needing to pull together. And it's lasted, 100 plus years because of that need. And there are shifts from time to time, from the national to the regional to the state level. And I think COVID has shown us in the position that we sit in, and it sounds like you're saying the same thing, is that there's a need for all of that. There are times where you have to, pull together as a community in a regional effort. And there are times where, the power nationally makes a lot of sense. And when those parties come together, it's when everybody seems to really be operating in a better way. So, as I said, I want to shift and talk about capital for a second, because we've hinted at the need and what shifted on the commodity side. You've talked about systems and interoperability. I'm curious what would be your recommendation, sitting in that unique spot that you do, on how organizations can better manage their working capital and stabilize cash on hand, especially now, given the strains that we all saw illuminated during COVID?
Yeah, it's a good question, and it's kind of a broad one too, right? It kind of goes without saying, and I think this is generally a true statement, that no matter what size you are, the primary relationship with your treasury bank is critically important, and just having those things in place. So those things being, do you have a normal cash management plan that's more than just once a year, right? And that may sound not very modern, but it's true, right? There are some situations where folks are creating a plan sort of once a year, and they're monitoring the plan. And you know what, for some years, from an overall cash perspective, you can make your way as long as there's, as long as sort of your revenue cycle behaves the same way and all those things. And that's frankly a whole nother topic. But I think where that gets challenging is, right, there's a theme here around things being dynamic, right? Our environment is very dynamic, even without a pandemic. And so what I would say is that we need to introduce more agility and flexibility into the way we manage cash. And so, the baseline for that is having those relationships, understanding what your working capital needs are, making sure that your treasury situation, cash on hand, short-term cash, and if you're doing things like mezzanining, to basically create a structure for both seen and unforeseen cash demands, then, that's sort of a baseline. So once you have that established, then we start to get into more interesting things, like how do you actually leverage those things in a dynamic way? So the first is establishing all those sources and levers. One thing I would say we have a huge opportunity to do, coming both during and coming out of COVID, is everything I've mentioned is sort of traditional financial management types of levers, right? Again, we think from a policy perspective a lot about, hey, when we do contracts with folks, then we set up policies and standards that support our working capital plan, right? From a finance perspective. The dynamicism of those efforts, though, could be improved greatly, right? So we don't tend to think about flexing those things as often as we flex things like, oh, we're going to need some more capital. I have a line of credit open, so I'm going to go, pull from some of that line of credit. Well, how do you make all those things more dynamic? So the first is, do you have some way, ideally through an agnostic platform, that says, oh, here's my landscape. One way to think about this, at almost any platform, we all know, is like iTunes, right? So if you think about the way we can all use iTunes, It doesn't, it's agnostic to whether you're a country music fan or, a rock fan or whatever your thing is, right, musically, or you could like all of that. Great. You can go find it. Um, and if you get turned on to something new that you don't know about, you can also find that there, right? You may not look at it every day. You may not have never looked at it, but it's in the network is kind of the point I'm making here. And if you want to do something with any of those styles, you can do it with, right? And this analogy is going to fall over a little bit, but basically the idea here is that, a lot of the options you have to create cash, and again, I'm sort of leaving out the revenue cycle for a second, are things that are all manifested differently. So the terms of what you need to do to go grab cash from a line of credit is entirely different than how you might pull from your treasury working capital account to pay a bill tomorrow, which is entirely different than the way you're set up for, how you manage credit card payments. All those things are managed separately and usually through very different processes. So to be more agile and take better advantage of how those being available to you, both in crisis and outside of crisis, is to have a way of seeing those in more of a dashboard view. Again, visibility, right? Theme, having that visibility across all these different sources of cash that you've got access to, and then being more creative about how you create other cash. So one of those ways is very traditional, which is, okay, do you extend your days out to try to create a better cash cushion for yourself? Well, guess what? In the spirit of being more holistic and thinking across the spectrum, COVID has also taught us that, guess what? Some of these suppliers are also getting battered. So, if your approach is to take your standard policy approach and say, oh, my cash is getting tight, therefore I'm going to put on the brakes and push out all of my payables, you could be creating downstream impacts that in some cases are unintentional, but could actually hurt you in your overall outcome to try to get more access to PPE, right? And there's a lot of ways that can manifest, but that's just one simple example of, a traditional way of trying to bulk up your cash position could be extending terms. Well, that might be a bad decision based upon the dynamics of the time. And I would tell you, in COVID, we've heard stories about that, right? Where like unintentional credit holds happen. It's pretty hard when your sourcing person is trying to go to a source and say, we're desperate for PPE. And then what they hear on the other end is, oh, well, you paid us late, so you're on credit hold. If they even have it, right? So there's so many dynamics here, right, that are active. But I think, in the working capital cash position, it's really important that not only do we have our bases covered, do we have visibility to all those bases? How easy is it for us to access those different, cash opportunities? And then are we thinking broadly about the other levers we have to pull, especially when we start to bring our supply chain colleagues in, right? So, there's been all kinds of temporary contracting going on during this time. So how do the policies that you use to do that temporary contracting reflect what you might need from a cash position? You might be willing to make different trade-offs today than you made when you initiated your initial sourcing contracts, right? And of course, we all know too that the consolidation of vendors, which is a best practice in traditional supply chain, has also created risk. So, how do you expand? It can be really overwhelming. How do you actually expand your access to sources? Also expand your access to cash and do all that in a way that's coordinated and synchronized, right? So you got to have access to your levers. You have to update your vendor management practices and policies like we just talked about. You have to think more holistically about it, right? It's more than just cash. It's also the vendor and other things. How do you balance those things together and have visibility to all of it to make good decisions? And then, do you have the right tools and platforms in place to affect all those things you want to do?
That's really helpful. And I like the word lever that you use, because it brought to mind a final lever, if you will, if I can play off that word a little bit, of a responsibility that's just innate to having a job and to having being in the workforce. And no better people that know this than those who are working in hospitals. They have the responsibility to the patients, to the families. You're talking about the other areas with suppliers and the way, their behaviors impact a full spectrum and continuum of unique individuals who are now brought together. And I think COVID has shown all of the players that have to be at the table who influence those decisions. But one we're leaving out, and that's the final lever I was going to talk about, is leadership. So meanwhile, supply chain professionals and finance professionals are trying just to keep, pace during all of this. But they still have a responsibility to helping enable the system to meet operational and strategic objectives. And as I said, the patient population needs. So what are some of the ways that you think supply chain and finance can partner together, as you said, be more agile in order to enable both the leadership and the strategic direction of the healthcare institution and ultimately impact patient outcomes?
Well, one thing that I think is obviously an unintended positive, because no pandemic is intended, is the level of what I'll call awareness and interest, some might call scrutiny, that senior leadership has in supply chain and clearly always have in finance, but I think it's taken on a little bit of a different turn, right? And so I think we have the benefit in these patient care supporting activities, right, like supply chain and finance. We have the benefit of attention now, right? So I think a really important aspect of bringing, oftentimes the challenge of bringing leadership in is attention. And so I think we have to be really cognizant that we're in a position now where we have attention, the we being finance and supply chain, we have the attention now. There's no question, right? So how do we best use that attention to shine a light on these areas that we think we can continuously improve, not just to respond to COVID, but to continue on after COVID, right? Because again, like we mentioned earlier, the need to evolve to value-based care delivery, both out of regulatory necessity and reimbursement necessity, but also frankly, just out of evolution, right? And modernization of healthcare. That's still with us underneath all this, right? So what's I think a best practice and the thing we need to be thinking about as we tackle COVID and come out of it is durable ways that we can get leadership and keep leadership involved in making these changes. Because here's the thing that changes that attention. One is the risk profile of the things we do every day in supply chain and finance has become elevated because now folks, sometimes it takes dramatic things to show what folks may have been articulating for a long time, which is there is risk here, right? There's real risk here. And any CEO, CFO, senior leader, COO, even chief medical officer, et cetera, they're thinking risk all the time. So now that they can associate that there's a significant risk in the traditional ways of doing these things, gives us the attention right now. So we need to make sure that we don't lose that spotlight as we sort of migrate, ideally, away from pandemic, hopefully in the coming months. So we have that attention. There's a few different examples, and I'll lean on one that has some, it's had some friction traditionally, but I think it's become much more and more a standard practice, especially as folks grapple with value-based care, which is the idea of a value analysis team, right? And to kind of paint that picture, right? And going back many years, right? Those are typically established to help really drive an outcome-based decision around what types of products and solutions and implants and things like that to provide to a hospital setting to deliver the best care and the best patient outcomes at the best cost, right? So just doing a really simple setup for this, and I'm using it just as an indication of a way to do this and keep that executive leadership attention, right? So it's well known that those activities only work if there's an executive sponsor. So number one, right, those things so there's a best practice there needs to be an executive sponsor. So I think it's supply chain finance typically always has a seat at the executive table. Supply chain, I think, has fits and starts, and in some organizations definitely does, and in some organizations doesn't quite. But I do think this new attention will help get more executive attention to supply chain. So I think this idea of the way value-based analysis teams were created gives us some best practices for how to do this for a durable way to approach these ongoing activities for supply chain and finance as a result of COVID. So, one is executive sponsor, got to have that. I think there's going to be more people who would raise their hand and say, yeah, I want a part of that today, hopefully for obvious reasons. The other that's super important is this idea of a equitable cross-functional team, right? So any good delivering value-based analysis team is going to have physicians and clinicians on it. It's going to have supply chain folks on it. It's going to have business process people on it. It is going to have finance folks on it, and others who are other folks who I've probably missed. But it's intentionally a broad-based group of people, and the outcome is the focus, right? And I recognize, having been doing this a long time, that in some of the early days, that wasn't always the focus, and there was some friction there. But the successful and durable ones today have gotten that they have to focus on outcomes. In this case, very important is the patient outcome, followed by financial outcome. And you put those things together, and it drives a much better process. And in order for it to work, it actually needs to be durable and consistent. It can't be just because we're adding a new service line, so we need to go build a team, and then it goes away after the new service line is on board. It has to be a durable part of the way you manage. So, again, holistic, cross-functional leadership from supply chain, leadership from finance, and then with leadership across the board at the most senior levels. A combination of those folks need to be involved in creating these groups. And again, in this case, it would be more of a supply chain finance best practices kind of team, or an ongoing business management type of group that is completely cross-functional. It must have visibility. And importantly, like we've talked about before, that visibility has to be beyond the four walls. And I'm using four walls colloquially, right? It could be a large system, but it has to be beyond the four walls of the hospital or IDN or system. Because again, we talked earlier about how important regional relationships are, right? So it has to go beyond those boundaries, and has to bring in the concepts of, well, what do the vendor relationships look like? And what does that look like for me and my regional partnerships? What does that look like for me and my regional partnerships and my GPO relationships? That all has to be brought into that consideration. And so in order to enable that to work, we go back to, do you have the right platforms in place? Are you doing the baseline of automating everything you possibly can, so that you're really dealing with outcomes and not just, business process? You want to get those business processes as much out of the way as you can from an automation perspective, so you're actually dealing with the challenges at hand and ultimately patient care, right? Because if you're just dealing with, well, can my employee work from home, and who has to come pick up the invoices that are sitting in our inbox, at the hospital to process them, and then has to go back a week later to pick up the check run. Though that's a really, people find themselves in really bad positions because of those non-automated practices. So you got to get that out. You have to have a way of seeing across not only your own four walls, but also what's outside of them. And how do you bring your outside your four walls in to your process? And that's that's why I use the iTunes analogy. Again, I know it's a little loose, but just this idea that you have a place that's agnostic, that you can go and get visibility to someone who you've never sourced from before, but could be interesting to source from. How do you give access to your hospital, right? So that's another thing that we didn't cover, but even hospital access has become challenged, right, in COVID and remote work. So you need a platform that helps you do all those things, and you need to keep that alignment around the outcomes.
I really like your iTunes analogy, by the way. I think to sort of wrap that part up, the reason I like it is because no matter what your genre, the whole intent and purpose of even going to your iTunes account is for enjoyment, right? It's to enjoy the music, but on the platform. Well, in the same way, you've already pointed to the way all of these different areas of the hospital can work together, inside and out, partners, regional partners, suppliers, finance, leadership, patient families, is if everyone is centered around that one focus, and in this case, it's outcomes, then things can be aligned better because we're at least agreeing. So that's what we're trying to solve for. And in the past, that might not have always been true. As you pointed out, everyone came to the table with sort of a different, what they had in their pocket and their own interest, perhaps, even if it was the interest of their collective team. But when you're doing that, you're not unified to the one. And I think, again, we learned a lot of lessons around needing to be unified and having partners that can help amplify what our mission is. And you said it. I mean, that's what healthcare is here for, is to improve outcomes and to make people healthier. So I love the iTunes analogy, and I think it ties very nicely into what that unified voice needs to be for everyone sitting at the table. Matt, thank you so much.
Thank you. It's been really great.
It has been. For all of our audience members, thank you for joining us today. If you are watching us on demand later or want to share this with somebody, if you're watching live, you can always download the content. There are attachments to learn more about GHX, the Center for Health Affairs, and CHAMPS, and as well as ways to connect with Matt and I. If you have more questions that you would like to reach out to us, we'd be happy to answer them for you. And I hope you all have a lovely start to this fresh new year. Thank you. Bye, Matt.
Bye. Thanks, Tracy.
Talk to you soon.